If you feel short of breath after 60, it can be easy to explain it away. Maybe it was the stairs. Maybe it was the weather. Maybe you have been less active lately. And sometimes the reason may be simple. But shortness of breath is not something to automatically dismiss as just getting older. If it is new, getting worse, happening while you are resting, waking you at night, or coming with other symptoms, your body may be giving you a pattern worth noticing. This does not mean you should panic. It means the pattern matters. Today, we are going to talk about why breathlessness can happen after 60, what details are worth paying attention to, and when it is safer to speak with a healthcare professional. This video is for general education only. It does not diagnose or treat any condition. If you have new, worsening, sudden, severe, or unexplained shortness of breath, please contact a healthcare professional. And do not stop, start, or change any medication without speaking with your healthcare professional. Many older adults notice breathlessness during everyday activities like climbing stairs, walking, gardening, carrying groceries, or doing housework. And the first thought is often, I'm just getting older, or I must be out of shape. Sometimes, doing less for a while can make normal activity feel harder. After an illness, surgery, bed rest, or a long period of reduced activity, your body may feel less conditioned than before. But here is the important part. One isolated moment is different from a repeated pattern. If breathlessness keeps coming back, becomes worse, starts suddenly, or feels unexplained, it deserves attention. Shortness of breath is a symptom. It is not a diagnosis. It may be linked to several possible factors, and sometimes more than one factor may be involved at the same time. One possible explanation is age-related change in the lungs and breathing muscles. As people get older, breathing may not feel as efficient as it used to. But aging should not be used as the only explanation without evaluation, especially when the symptom is new or changing. Another possible explanation involves the heart. Sometimes breathlessness can happen when the heart is not moving blood as efficiently as the body needs, especially during activity or when lying flat. It can also happen at rest or at night in some heart-related conditions. This does not mean shortness of breath automatically means heart disease. It simply means the heart is one area worth discussing with a healthcare professional. The lungs can also be involved. Some lung-related problems may affect how comfortably you breathe, especially if you have a history of smoking, infections, or chronic lung concerns. But the goal is not to guess the cause at home. The goal is to recognize when ongoing breathlessness may need proper medical assessment. Deconditioning is another possibility. If you have been less active because of illness, surgery, pain, fatigue, or reduced mobility, your muscles may tire sooner. Your heart and lungs may have to work harder during normal activities. This can make walking across a room, climbing steps, or doing chores feel harder than expected. But out of shape should never be used to brush aside new or unexplained symptoms. There are also circulation concerns that can be more urgent. A blood clot in the lung can cause sudden breathlessness and can be serious. This may be especially important if breathlessness happens after long travel, surgery, injury, illness, or a period of immobility. You should not try to diagnose a clot yourself. But sudden breathlessness in that kind of situation needs urgent medical attention. Stress, anxiety, or panic can also affect breathing. Some people may feel tightness, rapid breathing, or the feeling that they cannot get a full breath. But after 60, it is important not to assume anxiety until more serious causes have been considered, especially if symptoms are new, severe, or come with chest pressure, fainting, confusion, or blue or gray lips. So what should you notice? Notice when the breathlessness happens. Does it happen only with stairs or also while sitting still? Did it begin suddenly or slowly over weeks or months? Is it worse when you lie flat? Does it wake you at night? Also notice whether it comes with chest pressure, wheezing, cough, fever, swelling in the legs, dizziness, fainting, palpitations, blue or gray lips, or confusion. Pay attention to triggers too. Does it happen after walking a certain distance? After carrying groceries? After a cold or infection? After travel, surgery, injury, or a long time sitting or lying down? These small details can make your conversation with your doctor much clearer. Safe daily habits can also support safer routines and better conversations. Gentle activity, as tolerated, may help maintain strength and endurance. But do not push through severe or unusual breathlessness. Pacing can help. Slow down. Rest when needed. Notice what your body is telling you. Avoiding tobacco smoke is important. Keeping regular checkups can help your healthcare professional follow changes over time. If you have prescribed inhalers, heart medicines, or other medications, use them exactly as directed. Do not stop or change them on your own. Before appointments, it can help to write down your symptoms, when they happen, and what seems to make them better or worse. Now, let's talk about red flags. Seek prompt medical help for sudden or severe shortness of breath, breathlessness with chest pain or pressure, fainting, confusion, blue or gray lips or nails, coughing blood, one-sided leg swelling or pain, severe wheezing, fever with worsening breathing, or breathlessness after long travel, surgery, injury, or immobility. These signs do not mean you should diagnose yourself. They mean it is safer to be checked quickly. When you speak with your healthcare professional, you might ask what the most likely causes of your breathlessness could be. You might ask whether it could be related to your heart, lungs, medication, or fitness level. You can also ask whether any checks or tests may be appropriate based on your symptoms and health history. You may also want to ask whether any current medicines may be contributing, what symptoms should make you seek urgent care, and what level of activity is safe for you right now. After 60, paying attention early can make the conversation with your doctor clearer and calmer. Shortness of breath is not always serious, but it is worth understanding. It may be related to aging, reduced conditioning, the lungs, the heart, circulation, stress, medication effects, or several factors together. The safest step is not to panic and not to ignore it. Notice the pattern, write it down, bring it up, and seek prompt care when warning signs appear. If this helped you understand your body a little better, consider subscribing to After 60 Health Signals for more calm explanations of the body signals that matter after 60. And if your breathlessness is new, severe, sudden, worsening, or unexplained, please speak with a healthcare professional.